Good afternoon. Lee Harris, Mayor of Shelby County, pleased to be here on behalf of the Joint Task Force. We are working really hard to mitigate the spread of COVID-19, primarily in order to save lives and to reduce the strain on our hospital systems. Any one of us could need to see a doctor, go to the emergency room, or receive treatment. And so the most important priority of this work is making sure that we help those in need, reduce the spread, and make sure that our hospital capacity is available when any one of us may need it. So we'll continue to work on that for the next several weeks and several months. And so one of the messages you'll hear from the podium today is that we need everyone to do what they can to continue the course. In addition to that, we are always working on the economic recovery and putting more of our small businesses on the path to recovery. That's something that we need to do much more of. We are worried about our small businesses and working really hard to try to support them. In fact, Shelby County government just concluded a round of funding to the tune of $110,000 for the benefit of our theaters and stages, most of which have been closed during the pandemic. This round of funding went to our community theater organizations like Collierville Arts Council, as well as some of our well-known stages like the Hattie Lou Theater and the Growlers Concert Hall. In addition to that, we know that our restaurants and our restaurant workers are hurting, and that is something we need to work on significantly more. To that end, we intend to drive a conversation at the County Commission tomorrow about supporting small business, supporting the restaurant industry, and in particular, supporting restaurant workers. We believe that Shelby County can do a lot more, and so we'll bring that proposal again tomorrow. Let me just say for now, I'm really thankful to Commissioner Tammy Sawyer, who has been a really aggressive partner in structuring a program that could help restaurant industry and restaurant workers. And in addition to that, Chairman Eddie Jones has come on board as an advocate and supporter, and will be sponsoring the initiative that will be in front of County Commission tomorrow. In addition to all that, as all of you know, we're working on vaccine administration, which is one of the largest mobilizations since the advent of the pandemic, and in fact, it's one of the largest public health events from coast to coast, probably in the history of public health. Vaccine administration is not like testing. Recall that when it came to testing, we were able to take an all-hands-on-deck approach. So that means you saw hospitals, doctor offices, pharmacies, clinics, health department locations, and other organizations with the ability to quickly pivot to provide testing. Tests could even be self-administered without the aid of healthcare personnel at all. We even have the capability to expand the supply, since testing components could be produced locally with healthcare assets locally or labs locally. And with all of that, with that hands-on-deck approach to testing, we have in Shelby County, I think, tested around 850,000 tests across a 10-month period. And that's one of the best testing programs in the country based on several indicators. When it comes to the vaccine, by contrast, and the double dose that will be required, we'll have to vaccinate even a larger population ultimately than the 850,000 that I just mentioned. And we'll have to do it with many fewer hands on deck. Most importantly, for right now, the vaccine is not available for the public at our pharmacies. And so all of us are really at the mercy during this process of the national supply chain. When I say all of us, I mean both the local health department and I would say the state of Tennessee are at the mercy of the national supply chain, which hinges on the producers of the vaccine and their ability to scale up their capacity to produce. All current indications are that the supply could be scarce for the foreseeable future. For example, we know that the state of Tennessee expects to receive about 90,000 doses of vaccine per month, and at that rate, remember there are about 6.8 million residents in our state, and each one of those residents, or the herd immunity level of those residents, will each require a double dose. And so with 90,000 doses received statewide per week, it would take us at least a year to reach herd level immunity, given the double dose requirement. So unless supply opens up a little bit more, it could be several weeks before there is wide access, and it could be several months or even a year before we have achieved the kind of vaccination levels that are consistent with what we've heard about herd immunity. Now, there are some game changers on the horizon, so we want to remain hopeful. We're hopeful that additional companies will enter this market because they will have received FDA approval, and it is possible, and we were just talking a moment ago, it's possible that one of those companies may get approval for a single dose vaccine. And so it is conceivable, theoretically, that if that happens, that we may be able to cut our vaccination process in half from the double dose to the single dose. So there's light at the end of the tunnel. There are reasons to be hopeful, and we are working really hard to get all this done. But we do need to recognize that this tunnel is long, and it is likely to have twists along the way, and it will require all of us to make adjustments. So with that, thank you, and I would welcome to the podium David, who leads our COVID response team. Thank you.
Thank you, Mayor Harris. And just to give you an update on where we are statistically, we've had 70,532 people be diagnosed with COVID-19 disease in this epidemic locally, and that was 390 new cases reported yesterday. We're up to 945 total deaths that have been reported in the pandemic, and we had 615 people in the hospital last night at 5 p.m. So the numbers are daunting, but we want to put them also into context, at least when it comes to COVID-19 as a cause of death. And we have a slide to show today where we've done some recent analysis comparing the deaths in 2020 to our reported deaths from 2019 and showing where COVID would rank as a cause of death. So you can see that, and this is true in all years, heart disease and cancer are the two leading causes of death. And in 2019, we had 2,061 deaths from heart disease, representing almost 24% of all deaths in the county. Cancer of all kinds combined was our number 2 leading cause of death with 19.5% of deaths and almost 1,700 people who died in 2019 from cancer. Now in 2019, the third leading cause of death was unintentional injuries, and we had 576 of those deaths, representing 6.63%. So you can compare the 2020 COVID deaths and see that for 2020, COVID-19 will be the third leading cause of death. At the moment, we can document 903 of those deaths in 2020, but that number is preliminary and subject to change. It's certainly higher than that. But at that level, it would represent more than 10% of deaths in the county. And we also wanted to compare this to influenza pneumonia, or the complications from influenza infection. In 2019, influenza pneumonia was the 10th leading cause of death, with 173 people dying in 2019 from that cause, representing about 2% of the deaths in Shelby County. So you can see that with COVID-19 coming in at 903, that is 5 times the number of deaths. It's also 5 times the percentage of deaths, meaning that COVID-19 is 5 times more lethal than influenza. And that just helps you put in context what we're all going through and what we're trying to prevent. And for more information about those efforts, I'm going to turn over to Director Haushalter.
Thank you, David, and thank you, Mayor Harris. Good afternoon, everyone, and I hope everyone had a happy new year. I want to talk today specifically about vaccine distribution and the role of the health department, but our overall county-wide distribution. And then Dr. Randolph's going to give some additional updates about things that you can do until we get through this long tunnel of vaccinating a very large number of people. The health department received a little bit over 12,000 doses. Those doses were dedicated to individuals in what is called the 1A1 category, which is primarily first responders and those who provide direct patient care. And we knew that that was a very limited supply, and we planned as a health department, along with many partners, which I'll reference in a moment, to hold 2 closed pods. And a pod is a point of dispensing site or unit, and closed means that it's by invitation only. And that was to assure that we reached those individuals in category 1A1. And that was week 1. And week 2 was dedicated to doing on-site vaccination of individuals who live in nursing homes and other congregate settings. So as we received our initial doses of vaccine, the number actually went up. As we've noted before, things change daily. So we actually were originally slated to have a very small number of vaccines, and then we were able to receive 2 additional shipments that brought us to over the 12,000 doses. With the help of many partners, so I want to thank our staff, but also the Sheriff's Office, MPD, as well as police and EMTs from all of the municipalities, as well as many volunteers who pitched in. We were able to, in a 7-day period of time, vaccinate almost 9,500 people, which is a significant portion of the doses that we had. And the remaining doses are being administered this week to, again, those who live in nursing homes and those that live in congregate settings. As the week went along, what I recognized was that we had some open slots that were not being filled by appointments. So then we did open up to funeral and mortuary service providers to be able to fill in to those empty slots, and particularly to move into the 1A2 category. And then we also opened it up to individuals 75 and above, knowing that there were very limited slots and very limited vaccine. So I also want to thank everyone publicly for your patience, and I want to make a few key points because I think there's a lot of information out there, and some of it is not necessarily the most accurate information. As a health department, we do not have any additional vaccine. As Mayor Harris noted, this is a supply chain issue. Our community did not face the supply chain issues with testing that other communities did, but we will face and continue to face that particular issue for vaccine. We have to be able to know when we're getting vaccine, be able to promptly notify the public, and then be able to promptly administer that vaccine. Our calculations are that over a period of many months, up to a year, we're going to need to vaccinate at least 656,000 Shelby County residents times 2. So as was noted, that is a significant undertaking, and it's going to take everyone in our community to be able to achieve that goal. So the health department has a part to play, but so do healthcare systems, pharmacies, private providers, and so on. We're committed to continuing to provide current and updated information to the public, and we really ask everyone to pay attention to the health department communications because that will be most accurate. So for many months, we have released a daily update. We will continue to release that update around 10 every morning. And in that update, we will include updates around vaccine. That'll include whether we know we're receiving vaccine, who's eligible to receive the vaccine, and locations where vaccine will be administered. We will also share that with the mayors and other elected officials, as well as other Shelby County employees, so that everyone has current information. You can always reach out to us through Shelby TN Health. We receive a lot of emails, and through our hotline at 222-MASK. I will note, though, that we have received a lot of inquiries, and so the system is slow because it's being used quite a bit, but we do want you to continue to call or email us, and then you can go to shelby.community for updated information. The one announcement that I can make is that in partnership with the City of Memphis, the Pipkin Building at Tiger Lane will be one permanent site that we will have at least through June to provide vaccine when we receive vaccine. We are also working with a variety of partners to identify various community sites to be able to do pop-up or roving vaccine sites so that we can reach everyone who wants to have access to the vaccine. I encourage everyone to be familiar with the vaccine plan that was established by the state. There are various phases, and that plan will change from time to time. But there are two critical other components that I want everyone to be aware of. One is we also are focusing on age categories in addition to the employment or living priorities, but we also want to make sure that there is equitable access to vaccine. So it's going to be critical that we go to different geographic areas over time to be able to administer vaccine. I'm going to end with reinforcing what was already said. This is a phenomenal effort that we will have to undertake in Shelby County, and it's going to take many partners. The strength of the Joint Task Force has been that we have brought everyone's talents to bear to serve this community, and I trust we will do that as well as we begin to continue to administer vaccine. And I'm going to turn over to Dr. Randolph for some finishing comments on staying the course.
Thank you, Dr. Haushalter, Mayor Harris, Mr. Sweat. Greetings, fellow citizens of Shelby County. Dr. Bruce Randolph, the health officer for Shelby County Health Department. I want to just share a few comments before we entertain questions. Happy New Year's to everyone. I want to just simply thank all of you who cooperated and was compliant with the stay at home and directive and health directive number 16. We greatly appreciate it, and we want to encourage that you remain steadfast and hold the course. Do not think that because we began the vaccination that we can now relax and stop doing the things that we must do to remain safe, such as wearing the mask, maintaining 6 feet separation, avoiding crowds and gatherings, especially indoors, and also emphasizing the importance of ventilation and hand sanitization. And so we want to, again, thank those who were cooperative. Of course, there were some establishments who were not cooperative, and I just want to clarify some things because there may have been some misunderstanding. Food establishments, you must have a food permit in order to serve food, and you must actually be serving food. Just to have the permit does not in itself allows you to be open. When open, you are open at 25% capacity, and you must be have your customers separated 6 feet apart. Of course, our position is still indoor dining is discouraged. However, if it occurs, I want to remind restaurants, whether you're full service or limited, that you must have a license to serve alcohol. It is illegal for you to serve alcohol without a license, and also per regulations of the Alcohol Beverage Commission that you must actually be serving food if you serve alcohol. So again, just because you have a food permit and a food license or license as a restaurant, in order for you to open and have on-site indoor dining, you must have a license and you must actually be serving food and operating as a restaurant. And we just want to reemphasize that. Also remind everyone that the bars are closed You should not have people sitting at your bar. You shouldn't have people standing and gathering. No indoor smoking is allowed. And you must close at 10 o'clock. Now, we allow if people come in at 9:45, they've been served and they're still eating past 10, they're allowed to be there to 10:30. But after that, everyone should be out. You should not be serving someone at 10. The last thing I want to say is that entertainment venues, where primarily your business is entertainment or recreation, you are closed unless you provide and serve food. And it's the food or restaurant component that currently we are allowed to operate. Enforcement is still a major priority for us because though we have the vaccine, and until we get the 70% immunization rate, we still must adhere to and rely on the safety measures that we have in place. And so I'm asking that we continue to do the right thing, continue to adhere to the safety measures, wear your mask, maintain your social distancing, avoid the crowding and the gathering so we can still stay safe. With that, I will stop and entertain any questions you may have.
Kelly Roberts, WMC.
Hey there, good afternoon. My first question is regarding just that supply chain of vaccines. Now, do you guys anticipate having enough vaccines to administer that second dose for those who have already received that vaccine, over the last week or so? And how will people know, when to go receive that second dose? I know they got a date, but, was it going to that Pipkin building on the date, time-wise, that sort of thing?
I'm going to have Dr. Haushalter answer this.
So yes, we do anticipate having sufficient supply to administer the second dose for those who received the vaccine. Keep in mind that we received the Moderna vaccine, and so we have a 4-week window before we're needing to administer the second dose. We will be doing several things. One, we will be making announcements, particularly on where people can come for the vaccine. The other is that at the time that people receive the vaccine, they should have received a small white card that is their vaccine card, and it's really critical to keep that card. It has different pieces of information on there, including the lot number and the date that one received the vaccine, so that they know to get the new vaccine exactly 4 weeks later. And then people are encouraged to sign up for what's called V, as in victory or vaccine, safe, through the Centers for Disease Control. So the day that they receive their vaccine, they should sign up for V Safe, and they will receive a text message directly from the CDC daily to check on signs and symptoms of side effects, but also will receive notice of when to get the second vaccine. So again, pay attention to the Shelby.community site, our daily updates. We will also give notices out, and a text can come from the CDC, and we're also looking at our ability to also send a text message out to individuals. Do you have a follow-up?
Yeah, just my follow-up, and I know that you all have mentioned several times about this supply chain. Over the last 24 hours, we've seen different officials in different states in the Mid-South and elsewhere, talk about how slow the rollout has been. Local health officials talking about it too. I just want to hear from you guys too. Do you wish the rollout was quicker, but is this just the reality of it?
So it's our current reality, and we can always wish for things to be different. And so I would wish for two things. One is more predictability. As a member of the public myself, it's very difficult to plan if I don't know when there's going to be vaccine available through the health department, the hospitals, and so on. So I think predictability would really help the general public as well as healthcare providers and others know when to expect to get vaccine. The other would be not just quicker, but a larger supply. Again, we have come together as a community to address COVID-19, and I believe if we had a larger supply and could predict that supply, as partners, we could come together and vaccinate a larger number of people. And while 9,500 is a pretty hefty feat, we still need to get to well over 1 million injections given to get the first and second dose in. So we need to be able to bring this to scale, and being able to have a larger volume would allow us to do that in a more timely manner.
Michaela Watts, Commercial Appeal.
Yes, good afternoon, everyone. I wanted to ask a question about the new variant of COVID-19 that is said to be more contagious. I know in Shelby County, we don't necessarily do as much genetic sequencing of the virus as other counties. And so I wondered if this will present a challenge in detecting this strain, and then I'll have a follow-up.
Sure. Good afternoon. That's a great question, and our labs are already working on increasing capacity to do what we would call fingerprinting or the DNA sequencing. Currently, there is an ability to detect what's called an S drop-off, which means is there's an indication that there's a change in the sequencing, and then those specimens can be sent to the CDC. We also have capacity in 2 of the labs to do sequencing, so the lab directors meet regularly. I participate in that meeting frequently, and Dr. Jane participates in it regularly, so that we do believe we'll have the capacity locally very soon to be able to do sufficient sequencing to pick up when we have that new strain. But there are some other things that we would like to do with fingerprinting, is you want to have a good sense in a community, not just when you have the UK strain, but also what are the different variants that you have in a given community, and does that vary by geography, and are there specifics relative to that strain? For example, is it more transmissible? Do people tend to be sicker? Does it affect children differently? So we're really looking at how we use fingerprinting locally to drive our actions so that we can be as tailored as possible. And again, that's a testament to our local labs, not just the private labs, but the academic labs as well.
Thank you, Dr. Haushalter. And should this strain become identified in Shelby County, will that be taken into consideration when thinking about the next health directive?
If the strain is detected here, yes, that will be taken into consideration. We have had a lot of discussion in our clinical team, and I'm sure within the data subcommittee as well, of what would it mean to Shelby County if we had the UK strain here. And we actually believe that all of our current efforts are what we would continue. What we would change is communication to the public so that the public would be aware that the strain was here, and that there's 2 things that are being looked at, whether there's increased transmissibility or increased virality, and then we would make changes accordingly.
Jenny DePrizio, Local 24.
Yeah, hello. I have a question regarding the 90,000 doses a week that is expected to come to the state. Is that 90,000 of Moderna and Pfizer, or is it that the 90,000 of the Moderna that's specifically going that will be distributed to the counties? And if so, how much of that 90,000 is Shelby County expected to get?
So Mayor Harris used that number, but I'm going to make an assumption it's all vaccine that we would receive. So currently it would be both Moderna and Pfizer. And at the current time, we do not know what our allocation will be, and that allocation changes. So the example I've used is we had an original allocation to come to the health department. Then on 2 occasions, we received notice from the state that there was additional vaccine available if we could receive it. We agreed to receive it, and that increased our dosages. So there will be allocations noted, but then they might fluctuate based on what other counties are doing. And so I can't give you a specific number. I can say that we have said to the state that we would like some predictability and that we would be willing to receive a minimum of 7,000 doses per week if it could be made available to us so that we could plan accordingly. And then as we give vaccine, if we believe that we could increase that number, then we would ask for additional vaccine. But at the current time, we don't have a response.
Okay, and my follow-up then is, how many people in Shelby County are classified as 1A1 and 1A2? In terms of how many vaccines you have to give out to get past those first two categories?
So I don't have the numbers right in front of me, but I also want to keep in mind is it's not just how many do you have to give before you move from one to the next. There are several variables that we have to take into consideration. One, we want to reach 70% of that population, but we have to monitor what we would call uptake. And if there's any slowing down of the uptake, be able to move into another category relatively quickly. So the example that I'll use there is that we were monitoring the pod all week long, and we realized there were some open spaces, and we know that for 1A2 category, we had all other healthcare workers, which is a very large group, and we had funeral and mortuary service providers, which is a smaller group. So we opened up to that smaller group because we believed we could get all them through in the rest of the week. Then we also opened it up to those over 78. So it's not as absolute as some people may think. Oh, when you reach this number, you move to the next phase. You're constantly watching the patterns of uptake and opening up those categories based on that uptake as well as the numbers.
We're out of time. Are there any closing messages today?
I just want to reinforce that we have a long way to go before we have vaccinated a significant number of people in Shelby County, so it's really important that we continue the course. I do appreciate the elected officials' focus on economic recovery. We know there's been a significant impact, and so look forward to ongoing efforts to assure that we have a viable community, both from health and from a prosperity perspective. Thank you.
Thanks, everyone.